All right. Well, everything looks just fine. Do you have any questions for me?
Well, actually, I was wondering, I did have some questions.
Well, why don't we go ahead and get you some pants on and get you in a more comfortable position, and then we can go ahead and talk about your options.
Well, I'm pretty
All right, so
comfortable
what
right now, but
questions did
okay,
you
I'll
have
put some
for me
pants
today?
on. Well, Doc, I was actually wanted to talk to you about some important stuff. My boyfriend, Billy Joel, and I are getting pretty serious, and he's a real nice feller, and I've been telling him the last couple nights that I want him to show me that he loves me, and so I think we're gonna have sex, but I don't want a little Billy Joel, cause he's not mature enough to handle a baby right now, and so I was thinking that I should talk to my doctor, because my doctor should be able to give me something to make it so I don't have any babies.
You're right. That's what I'm here for. Have you heard anything about any options that you have? Is there anything that you know of that interests you?
Well, I've heard about some things. I always see that commercial on the TV of those people in the yellow suits jumping around, and they have that ring, but I don't think I want that. That seems really weird, and I don't think I want to stick my hands up there and put a thing in every month.
Okay.
And I don't know about the other ones, but I know those IUDs kind of look like aliens, so I don't think I want one of those either.
Okay, well, what a lot of people do at your age is use the pill. Have you heard about the pill at all?
Yeah, but not much. Is that Yaz?
Yaz is one of the brands of the pills, but the way that oral contraceptives work is that you take one pill every day at the same time, and you take that for 3 weeks, and then you go off of the pill for 1 week, and that's when you get your period.
So I'm still going to get my period?
You are, but you're not going to be ovulating. So there's no chance there's very, very minimal chance that you would ever get pregnant.
Can I still get pregnant when I'm on my period? Or we have to stop for a week? Like we can't, can we still have sex when I'm on my period?
If you want, sure.
Okay. And what about, I lately, well, maybe for a while, I guess now, ever since I started my period when I was about, I think 12 and a half. Well, my period's just really heavy. Like 3 or 4 pads every time before I'd have to change them. I'd have to change them, but I have to like double pad a lot, and I don't want to be doing that anymore. Can oral contraceptives help my double padding problem?
Absolutely. A lot of people do report that their periods are lighter once they're on the pill.
Well, can the birth control help with my back knee? Cause there was a while there where I thought I wanted to be an Olympic power lifter, because I do have a little bit bigger build for a woman. But I started taking me some anabolic steroids, but I don't think they really help that much. And I got some crazy back knee, and even a few on my chest, and those are just I know Billy Joel doesn't like my back knee very much.
Well, are you still taking anabolic steroids?
No, I stopped about 2 weeks ago.
Okay. Well, a lot of people also do report that their skin does get more clear once they're on the pill. So it does help some people with acne.
Oh, okay. Can it make my boobs bigger?
Some people also report that there is an increase in breast size. That's not with everyone, but there is a chance that, yes, it could increase your breast size.
Wow, that's wonderful. Now, how effective is this here pill?
If it's taken correctly, which means that it's taken every day at the same time,
okay,
it should be about 99% effective.
Okay, I think I can just set my alarm and take it every
morning. That would be a great idea.
Every morning before I feed my goldfish Tommy.
That would be great.
Now, one last question. Now, my mama said, now she doesn't know much about medicine stuff, but she sometimes reads, and she was reading something the other day that said that oral contraceptives are going to give you booby cancer.
You know what? That is something that's being researched right now. Okay. Research has shown that there is a slight increase in the risk of getting breast cancer if you've taken oral contraceptives, but it's a very, very low risk in the scheme of things. Okay. It also has been shown to possibly decrease your chance of other types of cancers, like ovarian cancer and things of that.
So I can keep my ovaries, but I might lose my boobs.
Exactly.
Okay. Well, you know what? That's a risk I'm willing to take.
Okay.
Because I don't want a baby. I mean, Billy Joel, he's a good guy, but I don't want his kid. I did have one more question I wanted to ask. Now, my boyfriend, Billy Joel, I've been telling you, Billy Joel, he's a good guy, but I sometimes wonder about him. He is a little bit, I don't want to say, but kind of on the dirty side.
Mm-hmm.
If he's got something, down there in that nether region, is it possible for that their birth control to keep me from getting whatever he's got?
That's actually a great question. Oral contraceptives, or the pill, does not prevent against any STDs. So if you wanted to be safe, which I highly recommend, you need to use something like a condom. A barrier method is what they call that.
And
So
that
we would
will
encourage
protect me from
condoms.
getting his funny stuff.
I believe condoms are about 98% effective.
Okay. So
So
as long
if
as
they're used properly.
Okay.
Mhm.
Okay. Well, I think that'll be good. I think that's about all I got.
All right, Petunia, it's been so nice to meet you.
Well, thank you, Dr. B. I can't wait to get me some of those magic pills. Thanks a lot.
No problem. I'll go ahead and get your prescription right at the front desk here, and you call me with any questions.
All right.
All right.
Thanks, Dr. B.
No problem. You have a great day.